Hello, my name is Rachel Matthew, and I am the Program Director for the Opportunity Alliance's Opiate Health Home. I'm going to talk a little bit today about our intake process, keeping in mind that this program is just over a year old, and so we have shifted our intake process a couple of times in the past year as we're sort of figuring out the program needs, the client needs, community needs, and staffing. Um, so for today's purposes, I'm just going to talk about what we're currently doing because we actually are currently intaking new clients. Um, so one of the most important things to us as we were developing our intake process was that it was as low barrier as possible. We knew that we were going to be working with a community that was more high risk, experiencing homelessness, actively using other substances, dealing with a lot of trauma on a daily basis. And so it was really important for us to be able to get folks in quickly and also do it in a way that was not traumatizing. For us, that meant not having them repeating assessment questions over and over again by different people, making sure that we were really assessing where folks were at. So if they needed to see a prescriber right away instead of a clinician, that we were able to accommodate that. If they were in a place to see a clinician first and complete a biopsychosocial, that we would do that and then schedule with the provider. So we really shift based on where the person is at and why they're reaching out at that moment. So when somebody is interested in the program, most likely they're going to call or have someone call our intake line. The intake line is for all of the Opportunity Alliance programs. Um, they will talk to an intake specialist who will ask them very few questions, mostly about they're interested in the opiate health home, are they interested in taking Suboxone, and if they have main care or would be eligible to apply and interested in applying for main care. Then they're going to get demographic information. One of our clinicians will call them usually within the same day or the next day. And at that point, we have a screening tool that we developed. That tool is really just for us to get to know where the person's at, why they're coming in at that moment, and experience they have with Suboxone, if they're using other substances, and to make the expectations of our program really clear. I should note that if the person calls our intake line and they're interested in a different program, our intake line would be able to direct them either within our agency or outside in the community. If we're talking to them during the screening portion and we realize that for whatever reason they're not a good fit for our program, they're looking for methadone, they're looking for just outpatient, they're looking for just case management, they don't want to see a therapist, any of those reasons, then we would work with them to refer them out. But during our screening portion, we have several questions that are also listed on our intake assessment. And we did this so if the intake clinician was able to engage the client in that moment and maybe they were going to be harder to reach later on, they could be able to start the intake process right away. And then once they got to the assessment portion, they would know that they already had some of these questions answered. And so those questions are what their supports are in the community, what recovery looks like for them. And then we're going to want to know questions based on their safety. Are they using other substances? Are they currently using opiates? Have they been on Suboxone? Where are they getting their Suboxone from? Have they recently experienced an overdose? Would they like Narcan right away? And then where are they staying? Are they going to be able to reach us? Can they come to our office safely? These are things that we want to make sure we know right away so that there's less barriers for the person. Right now we're doing telehealth, so we're assessing their ability to have access to a phone, to a computer, if we can work with any of our community partners to get them those things to connect with us. Those are the basic questions that we're asking. At that point, it's either getting assigned to a longer intake assessment with a clinician and or meeting with the prescriber. We also want to make sure the expectations of our program's really clear, that they are meeting with a counselor, that we have case management peer support, and that we do oral swabs or urine screens to see what is going on with the person. We don't use that as a punitive method, we use it as a curiosity tool. Um, and we want folks to know that off the bat. So that's our intake process. And thank you for listening.